The United States is looking to Canada to save it from problems that threatens the lives and health of millions of Americans. However, there are those who live in Canada that aren't as excited about this help that we're going to be getting. Now, just to make it clear, we're seeing hospitalizations shoot up in different parts of the country, and they're reporting 3 different yet also very similar illnesses. Those are the flu, the C-19, and RSV. Now, the problem is that there's a lot more than meets the eye, a threat that can endanger the lives of millions of Americans, especially as more and more cases continue to be reported. Now, in line with that, we're also seeing mandates that have been backed by the likes of the World Health Organization, the WEF, the World Economic Forum, now making its way back into our hospitals.
They're back. Hospitals in multiple states now requiring people to wear masks. Officials say that it's an attempt to curb an increase of respiratory illnesses, including COVID, the flu, and RSV. The CDC is reporting tens of thousands of people have been admitted to hospitals once again for respiratory illnesses each week this season. Our favorite doctor, Alok Patel, joining us now. Oh, boy. All right. So are you seeing more masks around your hospital? What's going on for you personally? And do you think it's a good idea right now?
Well, Kira, foremost, Happy New Year to you. And I'm honored by having the title of your favorite doctor. I don't take that lightly. So I and my colleagues who work in hospitals throughout the country are absolutely seeing an increase in respiratory illness, including hospitalizations from COVID. In fact, over the past week, we've seen increases, especially on the East Coast, and some states reporting a 30% increase, some a 60% increase. We're definitely seeing more masks. And I want to remind everyone out there that in a healthcare setting, when you already have an overstaffed hospital, staff shortages, you have patients who are already high risk, and you have several patients who might be in an emergency department or a waiting room who have symptoms, who haven't yet tested positive for anything. You've got to set up where you want to protect yourself. So we're seeing plenty of masks, and we wear masks anyway around any patients who may have respiratory illness because we don't want to spread anything to any other patients. We want to keep ourselves safe as well.
Year check. So this is the year 2024, not 2020, not 2021, and of course not 2022. I just had to clarify that because it feels like we're in a Back to the Future episode or movie or something. And I also want to raise a concern here, and it's obviously a serious one given the situation that we're in. With the spike in cases that are now showing up, should we all be concerned that hospitals will again overflow with patients and have them wait outside of hospitals for hours on end? By the way, if you guys appreciate the content and the research that goes into this, definitely hit the like button and subscribe to the channel. Also, if you own a home, make sure your home is protected. Get your free home warranty quote, link in the description down below this video.
Troubling news tonight about respiratory illnesses with cases on the rise and vaccination rates low. Morgan Chesky reports.
Are you experiencing any flu-like symptoms?
It's a scene playing out in clinics and hospitals nationwide, prompting an urgent warning from the CDC behind troubling new numbers. The agency alerting doctors flu hospitalizations have spiked 200% over the last 4 weeks. Hospitalizations for RSV and COVID surging as well. A wave of respiratory illnesses officials say is currently spreading fast, especially through the South.
How confident are you these cases are going to keep going up?
I'm 100% certain cases will continue to go up post-holidays.
At her Charlotte hospital, infectious disease Dr. Katie Passaretti told us it appears distrust of COVID vaccines is impacting other shots as well. As of last week, the CDC says only about 40% of children and adults have gotten this year's flu shot. The adult COVID vaccination rate barely breaking 17%.
It's really terrifying to me that we're coming out of a pandemic with even lower vaccine rates than we were going in.
Another concern? Holiday gatherings exposing new patients.
Sorry.
That doesn't sound fun.
It doesn't feel great.
We met Tracy Mullen on her way to the doctor.
I probably should have come sooner.
But tonight, the message from doctors, better late than never. While it typically takes 2 weeks for vaccines to be fully effective, in a flu season like this one,
at some point I have to close the door and say I can't see any more patients today.
Any protection could be crucial to keeping family close this holiday season.
Now, let's talk about what's happening around the country, all right? So right now, Metro Atlanta is seeing a significant surge in patients. So you might ask, what in the world is driving this surge? Well, like I said a second ago, it's the RSV, it's the flu, and of course C-19. Multiple hospitals in the area are now saying that their emergency departments, urgent care centers, and primary care, not to mention pediatric practices, they're all seeing more and more patients by the day. They're taking on so many patients that they've already announced that people who are looking for care in the area has to be a patient since they're kind of overwhelmed at this point. So let's see, where else? We've also got Florida with 5 counties seeing outbreaks in respiratory illnesses and expectations to have them surge all the way until May of this year. Not a good sign. Next up, Georgia. Since October 7th of last year, they've reported 10 fatalities and 1,582 hospitalizations due to the respiratory illnesses. They're blaming the holiday seasons as one of the reasons, with people coming and going from different places, which may have attributed to the surge. And we also have here Ohio releasing a statement that they're seeing a huge spike in cases, with the weekly count rising by 73% compared to late last year. Now, you might be thinking to yourself, what does all of this have to do with Canada, right? Now, to answer that, we have to figure out what's going on besides these spikes, okay? So right now, as I discussed with you guys recently in the previous videos, we are seeing drug shortages across the nation.
Doctors around the country are warning about a shortage of several important drugs, including ones that treat cancer.
Yeah, ABC's Andrea Fujii has the latest on what's at stake.
This morning, more doctors and lawmakers are sounding the alarm about drug shortages in the U.S., among them life-saving cancer medications, including chemo drugs.
These shortages can be life or death for kids, especially when it comes to the cancer drugs.
The FDA's drug shortage lists include those that treat lymphoma and leukemia.
We know how to treat cancer, but shortages force impossible choices. We have drugs that are life-saving and shortages that are life-threatening.
In comes Canada to the rescue as the FDA has approved Florida to import prescription drugs from there. However, and we all know that these plans never go so well, however, citizens in Canada are not too thrilled about this plan. You see, they've also had their fair share of drug shortages in recent years, and some were saying that to treat Canada as the United States' pharmacy is just not practical. To give you guys a little bit better overview of their concern, the population of Florida, and they're just talking about Florida here, their population is more than half the number of people living in Canada. So Canada has around, 38 million people? Meanwhile, Florida has around 21 million people living in it. So yeah, I can understand why they would be pretty concerned, although I don't think that they would sell all of their stock to Florida, okay? So I guess the concern is if other states are gonna follow through and possibly buy their medicine from them as well. Guess what? That's actually a cause for concern, especially since the drugs that Canada will be selling us will probably be cheaper compared to what we have here. And we haven't even talked about China and India, 2 countries that provide a whole lot of generic drugs to the United States. So is this move to look to Canada for drugs also a precautionary measure if ever China pulls out from giving us the medicine that we need? Which now raises a very important question, one that I hope that you guys can answer. Why aren't we manufacturing more of our own drugs from here at home? I mean, it's a fair question to ask, right? But like I said, I want to hear from you guys because this is definitely a problem that's going to affect all of us. Sure, not everybody in the hospital is sick with a respiratory illness, but hospitals are definitely filling up. What are you going to do if you have a medical emergency and all the beds are already reserved? You see where this is going, right? Make sure you guys share your thoughts down below. And before I go, I just want to thank you guys for watching. Thanks for hanging out, and I'll see you on the next one.